Okay, guys, today we will talk about colleague stations. Whenever you're working in any environment, there will be some situations when you will be given the task to go talk to your colleague. So, why it is very difficult for us to talk to the colleague or do these stations, do these type of the consultations? Because we don't really understand it. In order to approach any colleague, you have to remember one thing: your colleague is part of the team. For example, take example of anything: a soccer team, a cricket team, a rugby team. Every member plays a crucial part. If if there is no goalkeeper in the soccer game, so the team is not complete. No matter how the players are putting the efforts, if there is no one to defend, then the team is not complete. So this is what happens in when we are given the task to approach the colleague. So you have to do it in a way that the colleague is part of your team, and if the colleague is coming with an issue, not a problem. If the colleague is coming with the issue, you have to solve it. The reason we are not able to do it properly is because we think it's a problem. It's never a problem. Think of it as an issue. Your colleague is having an issue and you are given the task to solve it. That's why you are going to talk to them in a way to provide the solutions. So whenever you are doing a scenario, whenever you are doing a consultation where you are talking with your colleague, remember two things only. Only two things. The first thing is responsible, and the second thing is irresponsible. Whenever you're talking to your colleague, something happened, because there will be a reason for which you are given the task to go and talk to your colleague. For example, your colleague is coming late, your colleague, you, someone has seen or you have seen your colleague doing some activities or some using some illicit substances or working under the influence in the hospital. So whatever is the reason, whenever you're going, your colleague will give you a reason. This reason can either be a responsible or irresponsible reason. If you remember these two words, you will be able to approach it. So what are these words, responsible and irresponsible? Being responsible mean whenever you're talking to the colleague and they're giving an issue to you, it is a genuine excuse. So the genuine excuse means, for example, if I'm talking to you, why you coming late, and then you tell me, okay, I'm not sleeping properly, so that's why I'm not waking up properly on the times. So why you are not sleeping properly? Is there any problem? Or I broke up with my girlfriend, or my parents are going through a very hard time, they're getting divorced. So it is a reasonable reason, responsible reason, acceptable excuse. So definitely you have to take the insight of the colleague. If he knows why he is working, what are his responsibilities, what things he has to do, what hospital and patients are looking from him. If he understands it, means he has the insight, and the reason he is giving is acceptable reason, so it is a responsible reason. What is irresponsible reason? I'm coming late, you ask me why you coming late, or because I'm not sleeping properly. Why not sleeping properly? Because I'm playing video games all the night. And when you ask me about the insight, if I have the insight, so you have to talk about the issue only. You will not be talking about, okay, you know the importance of coming on time and importance of doing your duties. I know what are my duties, I know how important is it. So you have to, so what your management will be, your management will be only telling me the reasons, telling me, addressing my issues. What is my issue? I'm playing video games. For example, if I'm playing video games and I'm not coming on time and I don't have insight, then in this situation, not only you have to give me the solution, but you also have to tell me the importance. So this is the reason we are not able to approach these stations properly. So whenever a person is saying, whenever the colleague is saying, for example, I know how important work is for me, I know what are my duties, I know what hospital is looking from me, but I'm coming late. So in the management, if you are telling, you know, the importance why you have to come on time, you can save patients, you can do CPR in 5 minutes can save a life, recommendation letters, you have a responsible officer definitely will give you the review. He knows everything. He knows everything because he has insight. So what is the management over here? What is the issue he's facing? Address the issue. Oh, I'm coming late because I'm having a transportation issue. I don't drive a car. Maybe I live very far away. So your management will be wake up on time, get the buses on time, and try to come to the hospital maybe 30 minutes before it starts, or check the route before going to sleep, whatever. Or even if the student, or even if the person is coming from very far away, you will tell them to consider different options, which can be done in the case of the students. Yes, in the case of the students it can be done. So now coming back to the main thing, whenever you will ask your colleague why you are not, why why the colleague is having a problem, so they will give you either responsible reason or irresponsible reason. So these are very sensitive topics. Whenever you have to start, you have to introduce them very slowly. How you will introduce, for example, if the colleague is coming late and you have been told to talk to the colleague, so interpersonal skill will come in. he is he can be your junior, he can be your same post, he can be your senior, but still is your colleague, and you have to approach them. So whenever you talk to them, for example, if a colleague is coming late, what time, like definitely after doing the IPS questions, don't ask what department you're working in, because it will be given which department you are sitting. So how the rotation is going, are you looking forward to it, are you interested in it? If it's the student, so how the studies are going, any challenges you having, both of them ask any challenges you having with the studies or with the practice, anything. So what time you supposed to start, what time did you start? And never stop over here because when they told you to go and talk to them because they're coming late, follow the consultation, maintain the flow of consultation, make it look like it's a real consultation. If you are asking what time they're supposed to start, ask them what time they're supposed to finish and what time they are finishing, how they are coming to work. So that's how, even before he gives you a reason, your colleague gives you a reason, you are asking, you are ruling out things. How you come to work? Oh, okay, I come by bus or I drive by car. What time do you leave your accommodation, leave your house? How far do you live? So that's how, make it look like it's a real consultation. It shouldn't be, it don't make it look like you are scripted and you're gonna start, okay, you're coming late, the reason I'm talking to you is you're coming late. No, let them speak, let them ask why it is happening. Based on this, your management will be decided. For example, how the management will be decided on this basis, for example, you ask me about the insight. If I know how important my job for me is, if I know what are my duties, and then when you ask me why I am coming late, so I gave you a reason. Try to think if it is a responsible reason or irresponsible reason. If it is, now this is the problem we face, if they give us a responsible reason, they tell us, yes doctor, I know I'm coming late, I know what are my duties, I know what hospital is looking from me. I know there are patients waiting for me. In the management, will I be telling my colleague, you have to come on time, it is important for you, there are patients waiting for you, the load has to be divided, your colleagues, we are short staffed, or whatever is the reason, whatever that information is given to you, based on that you will move forward, and you will tell them. If you tell them the reasons why they have to be responsible, is it the management? They will tell you, I told you, I know what are my duties. So your job over here is why they are coming late. In the responsible, you will look into the issue and give them the solution. If it is irresponsible reason, because I'm going late to the bed, I'm playing video games, and I'm a student, and I know I don't have to check the patients, it's not my responsibility. There are doctors working in the hospital who will be looking after the patient. My job is to just take the history or do the blood test, carry the blood test from point A to the point B, and help in bringing the reports, whatever my responsibility I give. If you think it is irresponsible reason, irresponsible excuse, not only you will tell me the importance of coming on time, what hospital is looking from me, but also you will give me the solution. What is the solution? Go to the bed on time, play the video games on the weekends only, put an alarm, leave your accommodation early. If you have to change two buses, look into the route. Maybe look into, try to have a house or accommodation near the hospital. So this will be the management. The management will be based on the history you take. So that's why it is very important to take the history. And whenever a colleague is coming late, ask them if there is anyone to cover them in that time. Even if oh doctor, I'm only coming late for 5 minutes, 5 minutes doesn't matter. You can save a patient's life in 5 minutes. What if you get a patient who needs CPR, and you are not the doctor who is supposed to finish the night duty, has just left? There is no doctor over there. How we can save the patient? If it's a student, or even if it's your colleague working at your same level, the jobs, all there are always a responsible officers for every doctor. So they will be taking your information, how you are working, if you are complying with your duties or not. It will be recorded, and whenever you are applying for a new job, definitely you will give the references, and in references all the information will be shared, because definitely we cannot hide what happened. It will be explained over there that you were coming late, and you can have some issues gaining a job. Based on this, how what is the issue? Don't think of it as a problem. What is the issue? Give them the answer. For example, if I'm coming late because I broke up with my girlfriend and I'm not able to handle it, but I know what are my responsibilities, I know the importance of my job, I know my duties. Will you be telling me that in the management, will you be telling, oh, how important is it for you to come on time? You have responsible officers. Whenever it's escalated, you can land in hot showers. No. What about the mental peace? What about my mental peace? What about the issue I'm having? Did you address the issue? What I'm concerned about is, as you explained, as you told me, thank you for trusting me. As you told me you are going through this. So what about if you have you considered going to your GP? maybe they refer you, they connect you to the talking therapy, maybe they connect you to the communities where you can talk it off. You cannot hold on to this. Your mental peace is very important, not only for you but only for the also for the people who are here, for the people you're going to provide the care. So that's how you will manage it. If I'm coming late for the first time today, will you escalate the issue? That's why you are being told to talk to your colleague. What is the reason I'm coming late, and give me the solution. If I am doing it 4, 5, 7 very frequently, then it's a problem. If I have been confronted by a colleague and I'm still coming late, and then definitely you will escalate it. Definitely. Because when you will escalate, you will tell them, I confronted my colleague and the problem is still happening. Definitely, the first option is you will tell your colleague to talk to the consultant and your seniors. Who's your senior? All the junior doctors report to the consultant, and all the students report to educational supervisor. So they will be going to them and explaining the situation. You cannot do it on their behalf. You can accompany them if they are not feeling confident. You can accompany them, but they will be the one talking it. So okay, now coming back to it again. So escalation will be when someone has confronted, someone have given the solutions to the problem, and the problem is still persistent. If you see your colleague who's working under the influence, so how you will give the information? What information is given to you already? Based on that, you will talk to them. If it is written that you have seen them using some illicit substances, try to introduce it slowly. And if they are still not convincing, they'll tell them, yes, I was the one who saw it. If it was your colleague, someone saw you, you have been seen doing it. So it is the reason I'm coming. So now think of it at for one moment. If someone is using some illicit substances and coming to the work under the influence because they know the work is important for them, because they are also managing financially their families, themselves, a lot of things. So they're getting money out of it. And they have to come to the work. Very important thing in the part of the life. And if they are doing this very important part of their life under the influence, it means it is either an addiction or the problem is so out of hand that they cannot handle it. So in this case, what I'm doing in the management, all I'm talking about is, the importance of coming on time, the importance of checking your patient, your duties. No, this is not the management over here. The management, you will be giving support to your colleague. This is your job. You have to give some support. What support you will give them depends upon the situation, depends upon the issue. So for example, if they are having any problem with mental peace, if mental peace is the issue, so what you're going to do is refer them to the GP. So he's referred to the psychologist, and if medication is treated, psychiatrist. If I'm having illicit substances issue, then you will be referring me to the relevant department where it can be addressed. So that's how you will manage the situation, by asking what they're having. Based on that, it will be done. So in the management, yes, if it's persistent, if it's happening so many times that you are not able to, that the colleague is not able to handle it, it will be escalated. He will be given some solutions. He will be given the option to talk to the consultant. So the reason is, if someone else, you can give the reasons whatever you want. For example, I want you to go and tell the consultant, because the first hand story definitely matters a lot. He will come to know that you came, you have the insight, that you need some help. That's why you're going to your consultant. He will give you the option. Maybe he will give you any option better than what I'm telling you. So make it look like it's an option, not an obligation. And whatever you are doing is for the best interest of your colleague. So that's why just remember these three things. First thing, whenever you're talking to your colleague, it is for the reason that he or she is part of the team, not someone else. If you think of them as the part of the team, your management will be different. Second thing, the two words I told you. Whenever you're taking the history, whenever you got the what is the issue, if it is a responsible reason or irresponsible reason, based on that, you will move forward. So if someone is saying, yes, I know I'm having this issue, I know the importance, I know I should come on time, I will not be telling them the importance. I will be addressing their issues. So that's why, right in front of everywhere on the paper or whatever book you have, whenever you are talking to your colleague for any issue, you are supposed to give your colleague support and solutions. This is your job. I'm coming late, give me the support, give me the solution. What solutions you have? Before telling me, oh no, this shouldn't be happening, you're not doing the right thing. Why I am coming late? What is the reason? Address the issue. I'm using the illicit substances. Ask me why I'm doing it. Give me solution. Send me to clean myself. If I'm coming under the influence of alcohol, ask me why it's happening. Yes, you have to tell me that depends on the insight. If I know if my work is important or not, then you just give a fine touch. If I know my work is important, you will give it a fine touch in the management, and then you will be talking about, okay, what I'm concerned about is you are coming under the influence of alcohol. Let's talk about it. Let's give you the help you need. So whenever you think of these consultations as a support, you will be able to do these consultations very properly. So for example, if I'm the one who for the very first time told you the reason why I'm coming late, because I need some help, because I'm not able to handle the situation when I broke up with my girlfriend, you didn't even give me a reason. What do I think? Put yourself in the position when you are giving a issue to anyone and they are talking everything but solving the issue. Will you be happy at that time that I opened up to this guy and I gave all my worries, my concerns to him, and he is not even answering it? That's why be open-minded, actively listen your patient, and then manage it. Your management will depend upon, once again, your management will depend upon if the reason was responsible reason or was irresponsible reason. And always keep in mind that this colleague is part of a team. You are supposed to give them the solution. You are not supposed to just tell them straight away, you are not doing it right. It is something wrong. If I am doing it, yes, if I'm doing it very frequently, a lot of people gave me the options, solutions, and I'm still doing it. It is your responsibility that your team member is irresponsible. Escalate it. That's how you will approach every. Management remains the same. You know who to tell, you know what to do, but only two things. This is the reason we are not able to move with this consultation, with the colleague consultations, because we don't understand it. So we think of it as a problem. So whenever someone is coming, oh, you having a problem, no, it shouldn't be happening, it's so irresponsible, you have to come on time, you shouldn't be working under the influence. Yes, he shouldn't be working under the influence in the hospital or anywhere. What is the reason he is coming under the influence? Did you address that issue? Your consultation, your management completely changes at that time. When an issue is given, your management is completely changed. They are not concerned about at that time that whatever you're telling. They're concerned about they gave you a reason, if you answered that reason or not. And for example, if I'm not responsible, something happened and I put it on the social media or anywhere else, it is not permitted by law. Open the Google Maps, try to find a face or the license plate of any car in the street view. You will not able to see it. What is the reason? Sharing someone's information, name, without their consent. Ask your colleague before posting it if they have the consent of doing it or not. If they don't have the consent and they did it, because not only, yes, their maybe their relatives will come to know, the patient will be defamed, yes, but it is confidentiality. You're breaching the confidentiality by doing so. There is law that protects you. You cannot share someone's information without their consent on anywhere. The data can be saved, and by using it, some companies pick their data and do whatever they want. So that's why you will tell them no, delete the post as soon as possible. Go tell the patient it is your responsibility, whatever it is your responsibility to tell the patient what sort of support you are providing, what is happening with the patient. It is your moral responsibility to tell them. So if something like this happened, yes, you have to tell the patient what happened. So it's like something happened and they don't even know. And tomorrow some case or something appears and they will be like, I don't know how it happened, how my information was breached. You guys are doing it your whole life. For example, if anytime, oh no, I'm not gonna, you get a call and then, oh, I'm your local mobile service provider. Can you give me your date of birth and can you give me your full name and your all the information? Will you give it? No, definitely you will not give it. I don't know if you are the one, if you are the right person. Send me the email through them. Then I'll come to know, then yes, I'm talking to the right person. If it's required, I will be given. So straight away, will you be giving all of the information to anyone? No. Why? It is the same reason. That's why you this, and no matter. So for example, sometimes if You will be talking to the colleague directly, and sometime a person will be coming that, oh, this thing happened. One of, for example, I'm colleague A and I'm supposed to talk to you, you are colleague B. So when you are telling me that colleague C has done it, I'm not the one. So it means you are new, you don't know the law. So what I will tell you, the management will remain the same. That colleague C shouldn't have done it. It is not allowed. It is not permitted. He has to, colleague C has to remove the post. So that's how the management will remain the same. No important, doesn't matter how many people are involved in it. If it is not permitted, it is not permitted. Even for your consultant also. If you have to confront your consultant or your senior, then you will be telling them this is not allowed. If they are coming under the influence, that's okay. I am here to tell you what help you have. This is the reason I'm talking to you today. Definitely needs to be escalated, but give them the solution. That's how you will approach any colleague station. If you have these three things in your mind, only three things. First thing is your colleague is part of your team. Second thing is, if the given reason is a responsible reason, how your management will be, or if the given reason is irresponsible reason, what the management will be. That's how you will move forward. I hope it was a very quick talk about the colleagues. I hope you guys understand, and we'll do some other station next time. Till then, take care of yourself. Bye.